No.
When you sit in the chamber of the House of Representatives in the federal parliament and listen to Dr Mike Freelander, the member for Macarthur, you learn things. And I have the utmost respect for the member for Macarthur and certainly thank him for what he has done in his local community as far as health outcomes are concerned. I went on a trip with the good doctor to Papua New Guinea, where we looked at Pacific Global Health Initiatives, and I know that the follow-up that we did after that trip was beneficial to one of our closest friends and allies. In fact, Dr Mike's so good he should be the Health Minister. He should be the Health Minister, because I think if he was, I think I'd probably get more signed correspondence from him than I do the current Health Minister, the member for Adelaide, not a member for Adelaide, member for Hindmarsh. Apologies, Mr Speaker. Of the 29 reps that I've made to the Minister for Health, 28 have been signed by his Chief of Staff and one by his Acting Chief of Staff. And I know when I was the Minister, when I got a rep from a colleague, be it on either side of the aisle, you follow that up in person or definitely signed the correspondence back to them, personally signed it back to them in most, if not all, cases. But I do want to take, and I appreciate this is the Health Insurance Legislation Amendment, Assignment of Medicare Benefits Bill 2024. I do want to take the member for Macarthur up on some of the points that he made, because whilst I agree with him on some of the points that he raised, whilst I respect him always, whilst I appreciate he's probably forgotten more about health than most of us may ever know, I want to take him up on some of the points he made about the years that we were in government. And I'll start with, in Minister Butler's own words, bulk billing is the beating heart of Medicare, but it has plummeted by 11% since the last election. And that is a fact, that is a truism, falling from 88.5% when the Coalition left office in 2022, May of that year, to 77% under the Health Minister, the current Health Minister. And that is such a shame. And whilst in government, the Coalition did the following, and I know the member for Macarthur said that they were years of dysfunction and neglect. Well, that is not true, because we provided $99.3 million for 80 additional Commonwealth-supported places so more students can study medicine at rural campuses. And he mentioned National Party seats. Many of those rural campuses are in National Party seats. $66 million was invested to make it easier and more affordable to access Medicare-funded MRI scans in all regional, rural and remote Australia from the 1st of November 2022. And that was a big step forward. $36.2 million to establish 2 university departments of rural health in the south-west, Edith Cowan University, and Goldfields, Curtin University regions of Western Australia. Look, I appreciate this is a long way from my electorate of Riverina and a long way from the electorate of Parkes, where my good learned friend sits supporting me. But indeed, WA, I've been there many, many times as a member of this place, and let me tell you, remote health services and outcomes are so important, so important. $14.8 million to support Charles Sturt University to deliver a rural clinical school. We were also supporting, when we lost government, the National Rural Health Students Network of Rural Health Clubs with $2.1 million over 4 years. Now, this will be of interest to the member for Parkes, and I know he knows this very well. An additional $33.3 million. The member for Moreton comes in and starts yelling already. Right, he will get his turn. Over 4 years towards a 10-year strategic agreement with the Royal Flying Doctor Service worth almost $1 billion. Now, if there has been a champion of the Royal Flying Doctor Service, it is the member for Parkes. And so many of those people who fall foul of accidents and farm incidents who need the Royal Flying Doctor Service, they have been championing those services, that investment by the member for Parkes. And certainly his efforts in Western New South Wales have been second to none to making sure the right investment is in the right place, and very much that right investment in the right place was often with those wonderful people from the RFDS. In addition, we put $14.3 million to expand nursing and allied health student training in aged care to another 5 locations in the Northern Territory, Victoria, New South Wales and remote Queensland. Incentivise more doctors and nurses to work rurally by eliminating their health debts if they worked in rural towns and remote communities. Made telehealth permanent and universal, allowing timely access to health professionals no matter where they lived. And it was so important in those worst years of COVID, of the COVID-19 pandemic. And telehealth will never, ever, I hope, replace that personal face-to-face consultations. But let me tell you, it was vital in those years when there wasn't face-to-face contact possible. But also getting rural professionals is so difficult. And I appreciate the job that the government has to do. We need to do better. We need to do more. And I implore the government, those regional members of government, particularly if they sit on the cabinet table in cabinet, to do more and to be very vocal to make sure that their city friends address these rural health issues. Now, upon my appointment as Deputy Prime Minister in February 2018, I secured $95 million for the Murray-Darling Medical Schools Network. Now, that is making such a difference in Wagga Wagga, in Orange, in Dubbo, in Bendigo, in Mildura. Such a difference because it's making sure that the training is done and stays in regional setting from start to finish. And the chances are, if you have a person doing a course in a rural university, particularly medicine, if they start the course and finish the course in that rural setting, they're more than likely, 75% more than likely, to stay in that rural setting because they fall in love with the local community. They might fall in love with somebody in the local community because they're at that age where they're partnering up, and it makes such a difference. And to go to that biomedical science centre at Wagga Wagga recently, where they did the topping out ceremony, it was one of my proudest moments, I have to say, since being elected to this place in 2010, to see the progress made, and I look forward to the opening later this year. Now, that's some of what we did in office. This bill, although supported by the Coalition, we are very concerned, as we should be, that the government has stated that the bill quote, represents more progress on the government's commitment to strengthen Medicare. It has become clear, all too sadly, that under this Albanese government, that Medicare has only been weakened. Labor is overseeing a primary healthcare crisis that means it's never been harder or more expensive to see a doctor, and simply not good enough. It's simply not good enough. And one of the main problems with being able to see a doctor was the fact that the priority areas of distribution of GPs was changed when Labor came to power. And they've changed it such that once upon a time, certainly under the Coalition government, those priority areas were considered regional. Those priority areas were in remote areas. Nowadays, under Labor, they changed it so that a doctor could put his or her shingle up in Newcastle, in Wollongong, in the Gold Coast, and claim that priority area accessibility to the various incentives that government provides. And what that means now is that doctors are less inclined and less likely to then want to go and put their shingle up in a remote area where the doctors are in short supply. And then we get that insulting comment by our Adelaide Minister for Health, who says that in a regional centre, or anywhere for that matter, if you can't get a doctor who is happy to bulk bill, or put the phone down and ring the next doctor and see if they will. Well, that might all be well and good in the leafy suburbs of Adelaide, but I tell you what, when you're out in regional Australia, it's not that easy to get a doctor first up, let alone at all, let alone one who will bulk bill. And certainly if you get a doctor and get an appointment, you're not going to then quibble about being bulk bill or not. You're happy to get that appointment. You can have choice. You can be fussy if you want in a metropolitan setting, but you don't have that choice and you can't be that fussy in a regional area where you're lucky to actually have a doctor. And we know just how much the pharmacists, certainly regional pharmacists, were, I have to say, demonised by this Labor government, by this Labor health minister, who refused to listen to their complaints about the 60-day dispensing until they came and stood in the gallery in their white coats, or sat in the gallery in their white coats, and complained bitterly about the lack of funding that they were going to receive by this federal government. And patients, yes, of course, they are always first and always the most important, and chemists realise that, they acknowledge that. But when you have 324 country towns in Australia where the only health professional in the nearby vicinity is the pharmacist, they don't have a doctor to speak of, then those chemists should be listened to. And thankfully, the minister was dragged kicking and screaming to the Expenditure Review Committee table and finally did something when they signed the latest pharmacists agreement, the pharmacists accord, to make sure that pharmacists were looked after. But it took the Nationals to bring that home. It took the Nationals to make sure that that was even considered by this city-centric government. And as I say, the bulk billing rates are nothing short of disgraceful. Alarmingly, and there's a healthcare organisation called CleanBill. Now, alarmingly, CleanBill did a 2024 what's called a Blue Report, the electorate breakdown. It shows that the statistics are completely at odds with what Health Minister Butler and the Labor government have been trying to peddle, the nonsense that they've been putting out there. And CleanBill's report found that nearly 87% of electorates saw a decline in bulk billing at general practitioner clinics over the course of 2023. I'm sure the figures aren't any better this year. We're already into June. All the while, Labor has been pretending that nothing is wrong. Nothing is wrong. And we know it is. We know it is. And those Labor members who are in regional electorates, whilst they come in here and often just read from their talking points given to them by the Dirt Unit, they would know that there are real issues in their communities about accessing a doctor. And whilst this legislation, this amendment is supported, there are real and widening cracks in the health system that are not being addressed by this Labor government. And as I say, bulk billing is collapsing since Labor came to office. I appreciate the amendments will remove some of the current rigid paperwork requirements to allow for more streamlined processing of MBS bulk billing claims, particularly for telehealth consults. That's good. That's good. Well done. We support those sorts of things. Anything that can cut through bureaucracy and paperwork is to be commended. It will reduce regulatory and administrative burden for healthcare providers who provide bulk bill services, private health insurers and approved billing agents. Great. But when there are less and less bulk billing providers, then that is an issue. That is a major issue. And this will ensure the payment of Medicare benefits are aligned with modern practice and reduces administrative burdens for health professionals. If that goes some way to encouraging people to put their shingle up in regional and remote Australia, great. But I doubt it because of all the rest of the issues that I addressed earlier. We support these sensible amendments. They'll streamline processes for healthcare providers and private health insurers. But it is so hard. And you have a situation in the north of my electorate at Parkes where the Mayor, Neil Westcott, tells me that they haven't had a birth in the town in 5 years. Now, I appreciate this isn't just federal responsibility. There's state public hospital issues come into play. But Parkes is a town of 12,000 people, and Parkes deserves better. And I've certainly written to the Health Minister. I've written to the Regional Health Minister, Emma McBride, who I also have a great amount of respect for. She comes to this place as a pharmacist. But what we want to see is better and more health services for our regional communities. Certainly a town the size of Parkes when a town the size of Parkes doesn't have obstetrics and maternity services and it's got 12,000 people, there's something really wrong. But we do commend this bill, and I thank you, Speaker, for the opportunity to speak.
The question is that this bill